course, I'm a vet, but outside of that, I was starting to develop dental problems, and I knew sooner or later it's going to nickel dime me to death, and it's going to be hurting me. And I commenced to have some dental work done by a local dentist, and he had my insurance paperwork, and every time I went there, the price was changing around. And I checked a little bit into dental implants, but it was way beyond my budget. And I thought, well, I'm going to have to go with dentures. But the dentist that I was going to at the time, let's say he kept changing the prices on me. And one day I said, I thought you catered to cowards. He said, well, we do. I said, what about gas? He said, well, that'll be an extra $100. I'm in the dental chair. I had to reach actually in my billfold and get my credit card out for the procedure to start. I said, this is ridiculous. So I got home and I looked up. I said, for the heck of it, I says, I wonder if there's a place that gives dental discounts for dental implants to veterans. And I went on the computer and I typed in veterans discount for dental implants. And boom, the third answer came up to me, free dental implants for veterans. Whoa, I started checking into that. The VA didn't know anything about it at the time, and they suggested I call local dentists. And I called up a few dentists they didn't know nothing about, and I called up down Zanesville, and the dentist said, well, don't know, but there's a place called Dental Implant Institute over at Lewis Center, Ohio, and they look for volunteer patients from time to time. So I says, okay, so I called up over here, and they invited me to come on over for a evaluation, which I did, and the staff was very, very nice, very, very comfortable atmosphere to it, and you know, the idea of dental implant doesn't turn me on too well. Yeah, but anyway, so I say they did the thing, and one thing that amazed me was I've been a smoker a long, long time, and doctor says, he says, I've seen, Dr. Heller says, I've seen you had a tooth extractor lately, you hadn't healed up. And I said, how do you know? He said, well, he said, rather you smoke, because he says, I've seen you have an extraction that hadn't healed up. And he says, the reason why is because the nicotine won't allow the wound to heal. He says, I don't really care to deal with that with patients because of the infection problems that exist with that problem. I said, so in other words, you want me to quit? He said, yeah. Well, that was well over a year ago, and guess what? 0 cigarettes. So he asked me to quit, I quit. So, but anyway, he commenced to do this. He invited me back. So we are going in the procedure. I did a little research into it, YouTube, this and that. So basically, I come in and I'm told it's going to be about a 5-hour job, and he convinced me that, or he says, you know, he says he loves the dental work to be able to be done underneath the anesthesia. That's easier for everybody concerned, and actually, I don't remember too much of it. It was, I was told later I had to go to the bathroom sometime in the 5 hours. I don't remember it, so I don't remember going to the bathroom. I don't remember too much else. And I survived it, and the next day, it felt like I ate a Volkswagen, glass and all, but it wasn't really that bad. I do have to admit, it did let you know that when that 6 hours came to take the pill, you didn't want to play with it. You wanted to take that pill to make damn sure it didn't creep up on you. But I survived. The second portion of it was when I came back in and they actually opened it up, took the sutures out of it, and I was like walking around for a while with basically shoestrings tied in your mouth. But I survived that. And this Novocaine, when they actually go ahead and pull the sutures out, they open up the gums again to put the implants in. Well, the implants are already the abutments now, the abutment stage. That is uncomfortable because that's Novocaine. But, that's it. I'm not dentist friendly, I should say, but however, Dr. Heller is very, very good. He tells you relax, and he gains your confidence to where you're actually able to relax. The guy's good. I mean, what can I say? I mean, yeah, he's a professional. He does it, and he knows what he's doing. And yeah, it was amazing. It was pretty amazing that, I say I'm a chicken little when it comes to this, but I developed deep trust in the doctor that he knew what he was doing. And yeah, what can I say? I mean, let's put it this way. Okay, I'm happy camper. Okay.